Daktari, a quick one. Welcome back to part 2 with Dr. Samji here. Very interesting story. This guy went to a fake university. Oh my God. The things we go through.
The conversations we really need to have. Because I don't know. There's a Kenyan student. So I know one who never finished. Because now what do you do? She was, I think, in 4th year, 5th year.
In China?
No, now with this Dubai situation. And she was ready for graduation. But now the uni is shut.
Was shut down.
So what do you do? I have a colleague who is now a doctor, but had to start all over again in University of Nairobi. I have a friend again in Kenya whose mom sold everything, properties, just to put the daughter through school. And then nothing to show for it. So, I was fortunate I had family that was supporting, but not everyone...
Not everyone has the privilege for
So if you're sponsored by an organization or even an individual, there has to be some due diligence that even you as an individual should be able to do. Yes.
Exactly.
Yes.
And that's where, the career guidance you're mentioning. You mentioned your career guidance counselor was pretty laxed.
Yes.
That should be a bit more on the ground, as teachers at that level. I think it will go a long way. Because even same story here. When I talk to guys and they're like, I went into medicine because not because I really wanted to become a doctor, but because I overperformed. And then you end up doing something that probably you don't like. Some people grow to like it eventually, but not everybody goes there. So
yes. Yeah.
You live in now this is your entire life.
This is your entire life.
Yeah, living a life you really don't like. Yeah. Career guidance, I think.
Experience. And I think even we as doctors should have some platform where we can bring on board students who are interested.
True.
And say, guys, think about where you're going. Because yes, if you've probably studied the KCSE system, you're inclined to apply to a Kenyan school, perhaps. But there are people who may want to go outside. So the question is, do you want to stay outside or do you want to come back? And if you want to come back, then do you know what the requirements are when you come back? Will you be allowed to practice? Do you have to do a board exam and ABCD?
You should know.
You should know what you're getting into. Yes.
Career guidance.
Including, is the school accredited?
Yeah. So that you don't go waste your time in a fake
because there's like WHO, I didn't know. It actually has a system of accrediting schools.
I know thanks to you.
Yes, and ranking schools as well,
So now your internship in Homa Bay.
In Homa Bay.
You change and you go where?
So I go to Afia House. And I plead and I cry and I'm like, I need to go back to Mombasa, like it's family is there and it's easier and things like that. And of course, the Afia House will not. No, actually, they said write a letter, leave it here, we'll process it. Yeah. I remember one thing that they said is you people from Coast are always the ones with issues who always want to, change centers and, so I clearly knew that they're not going to help. And it's not, I don't know, I'm not brave enough, or it's not in me to open that conversation of Toaki Kidogo,
It happens. We had Dr. Rain here.
Right.
Rain trained in Russia. And he said when he came back, before he could even be allowed to do internship, he had to go. He was taught, no, you're in Kenya, man. This is how we work.
That's unfortunate.
Yeah, it is unfortunate. We hope to change it in the future.
Yes.
So
I got to, then I went to Mombasa and then I said, let me try things locally. So I got an appointment with the County Department for Health, Mombasa.
County.
What
year is this? Is it post-devolution and stuff? Your phone is okay.
Probably. Yeah, this was 2015.
Okay.
15 County. I graduated, so 16 I came back. And so I went to Department of Health Mombasa and I said, look, this is my situation. Can I get assistance? And they were very helpful. Dr. Shikeli at the time, very, very helpful so she was empathetic. So she moved. She got me a slot in Kilifi because the intern in Kilifi was moving to Coast General. So that opened up things for me. Yeah.
So you went to Kilifi.
So I went to
She wrote
Kilifi.
a letter. You went
She wrote a
to
letter and
MOH,
she instructed to
transferred.
MOH, the same office that I wrote a letter to, that now kindly transfer this guy from Homa Bay to Kilifi and this one from Kilifi to CPGH.
So you went to Kilifi.
So I went to Kilifi. This was now, I think, early 2016. Yes.
And from Kilifi? You said you did 3.
No, then we had that Lipa Kama tender.
Oh,
The
Lipa
longest
Kama
strike
tender.
I've ever been in.
This is 2017 now.
2017 now, yes. So,
yeah, they kept us at home. I was in med school. It kept us at home for those 3 months.
Right. So now I'm working, and obviously I'm at home for, was it 3 or 6 months? 6 months, I think. I had to now move back home to my parents' place because I can't afford rent. I can't feed myself. Fortunately, I had no other expenses like loans or whatever, but you know, basic survival was a problem. So I moved back home. Hospitals were closed. I mean, we were not functioning at the time. And then I said, you know what, I can't do this for very long. So let me look for another solution. Even when the strike was called off and we went back, the hassle of now looking for another place to live, moving all your things back from Mombasa to Kilifi, and the thought of this happening again, what am I going to do? So I said, what else is there? So at that particular point, Aga Khan had an opening for internship. So I applied. And this is me now halfway through internship, 6 months done. And I went to Aga Khan, I interviewed, and the lead physician who was interviewing me said, you know what, we're happy to consider you, but you just know that you're not continuing from where you stopped. You will start internship day 1. Hey, Daktari, it's been a journey.
But that is the Aga Khan way.
Yeah, you can't blame them. I mean, they also have their processes to look at.
They want you to be in their system.
Yes. So I started internship day 1 again, did an entire year.
Oh my God.
Until I was done.
Oh, Daktari, you're resilient. Mimi ningesikia you start over. I'm like, hey, you guys, hey. Start over, nini?
Imagine.
So you did a whole year now.
I did a whole year. And I didn't mind because internship in Aga Khan is very different.
Yeah.
In the sense that it's very good. It's an amazing program if you are looking for a future in internal medicine, for example, because you know the equipment is there, the processes are there.
Systems flow. It's what us who went to some fun internship centers we would call an ideal setup.
Yes,
we always talking about in an ideal setup I would do this. So Aga Khan, I think, gives you
because
that.
when I was doing internship in the government setting, I remember casualty. You get an unresponsive patient, or you get a code blue basically. There's no crash cart. There's no defib.
There isn't ECG machine.
There's no, So all you're doing is epinephrine, chest compressions until you're tired, and then you say, police.
And even the success rate is usually there's not even ICU.
Yes. You're almost assured of a poor outcome.
Yeah, there was a time I was in a county hospital and I asked them, okay, so you guys, when you resuscitate, what's the end goal?
Yes.
Because a resuscitated patient needs to go to an ICU.
Yes.
You guys don't have an ICU here.
Yes.
Why are you resuscitating? Where will you take him?
Exactly.
If the resuscitation is successful.
Exactly.
So like, hey, this is something we just do for show.
Yeah. So I didn't mind because in the government setting where I was doing internship initially in the first 6 months, I had hands-on experience in surgery. I had done CSs, so I got that part of it.
Now that's the balance. That's the
balance.
trick.
Yes, even though in Aga Khan they have an MOU with the government hospitals.
Oh.
Yes, so if you're doing like a 12-week rotation in surgery, you'll do 6 weeks in Coast General. You do 6 weeks in Aga Khan.
So that you get the hands-on.
You get the balance, but it comes with its own drama. You've got COSEXA residents, you've got MOs, interns. So now you're a visitor trying to get theatre space.
Yeah, it becomes tricky. Who do you think?
Yeah, who do you think you are?
So that's how you got yourself in the Aga Khan.
Yes. So I finished internship, and then I think that was also the time where there was no automatic retention anymore wherever you worked.
Yeah, true.
Aga Khan, would retain you if they have an opening as an MO. Somehow I didn't find myself being retained as an MO. I found myself in now quality improvement, patient safety. A totally different ball game.
Did you want to go that side? Or did you want clinical?
You
And
know,
then,
I wasn't so sure. I think I was so exhausted by the time I was done with internship that
it's
I
a
was at
long
the point
journey.
where I'm
You
done.
started in 2008.
Yes.
It's been 10
It's
years.
been 10 years.
Yeah,
It's
it's a
been 10
long
years.
journey.
So I was like,
It's no joke.
is this, maybe it's not what I want to do.
Yeah.
Let me try management.
Oh.
Yeah. So, yeah, internship was hell. As it always is for most,
Yeah,
it's hell.
Oh, me, I enjoyed it. We did.
you did?
We did. We actually did because the online we had some interns complaining about toxicity and stuff, and me and Dr. Renske we did a podcast. It's actually on the
okay.
about internship,
Right.
and my internship was good.
Fantastic.
I
The few
enjoyed
lucky
it.
ones.
I enjoyed the few lucky ones. I
Yeah,
enjoyed it.
yeah.
A few wrangles, but
Yes.
where I trained. We had been used to those kinds of what people call toxicity and
Right,
stuff. So
right.
when you meet such things, you're like,
Yeah.
this is very familiar.
Yes.
I think I would actually have struggled if I went to a place that was super nice.
Right.
Yeah. So you got into management
I got into management and I
right
was
away from internship.
well, I mean, okay, I wanted to be retained, and it was there were interviews in
Is that the
Irfan,
opening
Mombasa.
that was there? And then you applied and
No. So I was so there were applications for medical officer positions post internship, which open to anyone who wanted to apply. I wasn't actually. I was waiting to be interviewed, but I wasn't interviewed because the leadership had sort of decided that I was going the management way.
they just saw you like
I think that I don't know. They saw
that
potential,
one's a
or I
leader.
don't know. Yeah, but I had a fantastic CEO of the hospital at the time. My immediate supervisor was fantastic. Shout out to Dr. Christine if she's watching this. But a lot of it I learned from her. What it means to be in quality improvement and patient safety. So I didn't actually regret it entirely because there was a lot of on-job training that I got at the time. And then I grew to love it. And I carried on. I actually left in the pandemic. I quit my job.
Why?
So I quit my job
Did
because
it become too much?
No.
The hospitals over.
So it was very tough in the sense that there was a lot of pressure, expectation, because by that time, aside from being the QPS physician, I was heading infection control. So now with the pandemic,
COVID is now infection.
yes, it's
Infection not controlled.
I'm expected to come up with or to contribute to the rest of the so we had a COVID-19 task force for AKDN, and I was part of that task force at the time, and I was expected to put together a plan for a field hospital together with my colleagues. What happens if the hospital is overwhelmed? There's no space. You need to overflow. Where do you go? Those kinds of things.
And it's a new disease.
It's a new
We
disease.
don't know how to manage
PPEs
it.
are in short supply. So now you have to create an SOP for reuse of masks. How many times can you reuse a face mask safely? And the doctors are looking at me like, you're the one who's asking for us to die. How are you asking us to reuse face masks? Honestly, that kind
And
of.
you've been with it to the sick patient.
Yes,
You're supposed to discard it.
yes, you're supposed to discard it, but and that's when we actually learned that there's WHO guidelines for reuse of single-use PPEs as well, and 95 masks. How do you safely reuse them? Putting a surgical mask, a clean mask on top, discarding that, and then reusing it 5 more times safely, but storing it appropriately and things like that.
I didn't even know that.
Yeah. So there's
it was overwhelming.
Not that it was overwhelming. I think by the time I was leaving, things were status quo. We were at that point where vaccines were here. So we were vaccinating. We were on second vaccine, and now waiting for booster.
By that time, I think things were cooling down.
Things were the wave was
I
coming
remember
down.
that was my final internship days. Actually,
Yes,
as well.
yes. But I left because business was fantastic.
At this time you have a business.
Yes, I had started a consultancy company.
What were you consulting on?
Medisam Consultancy. So what it was doing is home health care.
Home-based care.
Yes, because patients were still afraid to come to the hospital.
Oh, yeah. You saw the opportunity. Did you start
I
it
saw
then
the
or you
opportunity.
had started
No, I
it
started
before?
it then.
Ah.
So I said, look, there's the opportunity there. Patients were willing to pay Insurances were willing to reimburse a certain amount. Private insurances were willing to pay. The patient would pay, give the invoice to their international private insurance, and they will get a claim of that back.
Okay.
So I set it up. I got a team.
You said it was called what?
Medisam Consultancy.
Medisam.
Yes.
Have I heard of that? Sounds
Probably.
familiar.
Probably, yes.
Yeah.
So yes, it was based in Mombasa, but at some point we started offering services across Mombasa and Nairobi. And then I looked at what else do I know, and how can I grow the business further. So in addition to home healthcare, I went into medical supplies then. Yeah.
Okay.
And then I went into cleaning and disinfection, specifically now for home healthcare.
For home health.
Because we were also offering it to not just to acute patients, but even to patients, not even patients, but you've got elderly family, for example. Your parents, you work in Nairobi, your parents are in Mombasa. You can't have the time, you can't have them with you.
Yeah.
You can't also come down and take care of them. You also don't want a house help to be taking care of them 24/7. You want someone who understands if they've got clinical situations, someone who is also empathetic. So we got 24/7 caregivers, people who would be specializing in feeding, so giving you meals, empathetic care, taking you out
so
on
these
walks.
are like the nursing aides and the nurses?
Yes, yes, giving you a really 360.
So home-based care properly.
If you are, if you've got dementia, for example, then these caregivers will sit with you, read the newspaper to you, do crossword puzzles and things like that. And so that really grew. And then I said, okay, I'm missing one more aspect. So I've got experience in clinical quality improvement. And there were facilities, private facilities, consultants who've set up their clinics or who've set up small establishments. They've got a lab and everything, and they're saying, okay, we may not want to go for things like Safe Care, or we're too small for Joint Commission or JCIA, but we want someone to handhold and say, okay, this is how you get your services or your quality of care from level A to level B.
How to grow.
How to grow, how to make it more streamlined. And so I provided that hand-holding
so
to
consultancy
now.
From your experience in Aga Khan.
Yes. So I was trying to do a little bit of a lot of things under one roof.
And how is that? How is that now?
So I stopped.
You stopped all that?
Yes.
Even the home-based care?
I put it on the back burner right now. Of course, with me working in Aga Khan, I wouldn't be able to do it.
So you came back to Aga Khan now as
yes.
Now the AKUH.
AKUH Nairobi. Yes. So I came in here as the quality advisor, similar to what I was doing for AKHS Mombasa. So I was offering. So at that time when I was employed, the hospital was looking to prepare for Safe Care certification.
Okay.
So we were going for the first 5 centers. Ended up going for 10 centers. And we got level 5 for all of them.
Wow.
Yeah. So I think we just finished 15 centers by the end of last year.
Doing Safe Care. For those who don't understand, Safe Care.
So Safe Care is a quality improvement platform, or it's a system that's been put together. So it's the product of 3 organizations: Joint Commission, JCIA, which is the American one, Farm Access, and ISQA or COSASA, one of them, but the South African one. So they all came together and they said, let's create healthcare standards for hospitals and for small facilities that are in resource-constrained settings. So not particularly, so even private hospitals that are not resource constrained can go for it. But if they are in a setting that is resource constrained, so Africa, for example, would go for Safe Care certification.
Oh, okay.
And it's very different from Joint Commission, because Joint Commission is very stringent, very, very difficult, very expensive. And it's almost yes or no. So if you're being audited on a particular standard, you're either met or not met. There is not partially met and things like that. Safe Care gives you opportunities to grow. So, for example, if they audit you and you're at a level 3, they will give you an improvement plan and say, by the time we come back for recertification, which is usually in 2 years,
you should be.
We'd like you to be at this level, which will now take you from level 3 to level 4.
Okay.
So that's what it is.
And you've managed to do that for 15 centers?
Yes, I supported the hospital. Of course, it was a team effort with a lot of other colleagues. But yes, from the quality aspect, I supported the hospital for 15 centers. All got level 5 on the first try.
Amazing. Yeah.
Yes. So usually by the time you're at level 5, it's an indication that you are okay to go for JCIA, for example. You're at a level of quality that's considered JCIA.
JCIA is?
Now the Joint Commission. So what the main hospital has, which is the gold seal.
Okay. Ah.
Yes.
Good work. Irfan is doing some good work. Eh?
Yes. Fantastic.
Fantastic. So now family medicine, how did that come? Because now I'm saying your quality. You had said clinical aside, but then you decided to go back?
I went back and...
How was that decision? Because I think once you spend all those years in management, coming back to now see patients, does it feel new? Does it feel like a new environment?
It did. It does feel like a new environment, but I was able to gel in very, very easily, very quickly. But I appreciate my background in quality improvement.
Okay.
It made me appreciate a lot of what patients expect in the clinical setting. Simple things of how you communicate to your patients.
Yeah, true.
Sometimes even if a patient has not waited for too long, but just them coming into your clinic, into your office, and you saying, "I'm sorry to have kept you waiting for so long," changes the entire mood.
And then they're like, "I haven't even waited.
I haven't waited," and then Daktari is apologizing. Oh my God, it's So I picked a lot of experiences from quality, and I've implemented that in my practice. But I think the decision came from me thinking about the bigger picture. Because yes, there is a lot of growth for quality improvement in the private sector. But to a certain extent,
there's a destination. You can get to the end. That's what you mean?
You can get to the end.
And then
you can stay.
No more quality needed.
Yeah. No, not that it's no more quality needed. Like even standards are always changing. JCI have come up with 8th edition. So SafeCare also have a new standard that they're introducing. And you see with, for example, if you become a teaching hospital and now you're being audited for academia as part of the audit scope, or now with artificial intelligence coming in, it broadens the audit scope as well. So there's always going to be that need for someone to read in depth and give that guidance. But for example, if you become the department head of quality, for example, in a particular facility, then that's a particular destination. What would you like to do beyond that? If your facility has, for example, a network where you can now support at a regional level, or you can support at an international level, then yes, there's more growth for you. But when you get to a certain point, you could be a quality advisor for a good 10 years. If opportunities within that organization don't grow, it's very, very possible.
You can remain there.
Yes. There are, I'm very confident that in the next 10, 20 years down the line, even government hospitals will start looking at quality from a very different aspect. Yes, of course, once...
Hopefully so.
With our leadership.
To get the basics.
Yes. And it has to be a leadership priority as well, at the top.
True.
But I remember there was a point in time when this whole conversation of universal healthcare started. We had, and at that time it was still NHIF, but there were conversations about, because SafeCare is local, it's sort of tailored for local facilities. It would be, there were conversations, they were not solidified yet, but the vision was, can it be pegged on NHIF accreditation for facilities? Can it be accredited on you being able to offer that insurance cap to your patients? If you go to the US, for example, hospitals that are Joint Commission accredited will then have isn't Medicare, Medicaid, or whatever in the US accredited, Medicaid, so they can offer insurance to patients. If they don't get some level of that Joint Commission accreditation, it's pulled out or it's stepped down.
Okay. So it's just to be pegged now to now SHA now.
To now SHA, SHIF, SHA, NHI, whatever it was at that time, I think conversations died down at some point. Politics here and there, so it didn't really move very much.
Sharing quality in this government hospitals can be tricky.
Yes, it can be tricky. But I'm sure that 10, 20 years down the line,
if we get the leadership right.
Yes, for sure. And that will create automatic opportunities for growth for anybody in the quality improvement sector.
So you felt probably might hit a stagnation at some point? Therefore, you think being in the clinical setup, I think
opportunities. Yes, I think opportunities would always be there because, yes, if you're in quality improvement, there are opportunities. So I, for example, am a CPHQ. So I'm a certified professional in healthcare quality, accredited by National Association for Healthcare Quality in the US.
Okay.
So it makes you, basically it's a title that you get. You can put it after your name. You are licensed to be able to provide quality advice, guidance, and things like the hand holding.
Okay.
And there's always facilities across the world that are looking for someone in quality. Yes.
True.
But if that were not to happen, if those opportunities were not to present themselves very easily, then what is another fallback plan?
You need that.
You need that clinical, So yes, I looked at family medicine as an opportunity because that in itself has had significant growth over the last few years.
True. And I think it's the best way to go. Even if we're looking at now more of preventive medicine.
Absolutely.
And primary health care, those things.
Even in quality improvement or patient safety, for example, there are a lot of facilities that are looking at having a family physician as the lead doctor in the outpatient sector, in the ER or outpatient department, for example. Yes. And I was told there are conversations about having even the medical officer interns during the internship. Part of the rotations will be in family medicine. There are conversations that I've been told.
Interesting.
Yes, so I think facilities will eventually, even in the government sector, have a family physician based in casualty, for example. I think there are plans there, is what I'm told.
That's good.
And that will present growth opportunities
for people who are pursuing that.
Yes.
So how is school?
School is
enjoying
great.
it? Is it different from China?
Yes, it is different. I think it's different from a lot of things in that adult learning makes it easier.
Easier or harder?
I mean, okay. One thing that made internship very hard was maybe the consultants were very mean.
Yeah, they were. But we're trying to change that.
You are the who are you who doesn't know anything, coming into the playing field. But now it's like, yes, at least for the program that I'm in, my supervisors, my consultants, very professional, very respectful, very understandable of the fact that we're
also doctors.
We are one step closer to consultants at residency level. And they understand and appreciate that we have schedules. We're running clinics out there, so it's a little more understanding when it comes to more flexible. Even the course is structured towards that kind of a schedule as well.
Online classes, things like that.
Online classes, you have a couple of days. So you have your major ward rounds. You've got your once a week bedside learning, where you clerk and present a patient, and
interesting. All the best, Daktari. Can't wait for you to become a family physician.
Asante.
But other than that, you do something else that's very caught my eye. You post a lot of cakes. Sasa unajua sisi hapa as patients look at you, Daktari, you told me not to
stay away
from this too much carbs, but you want to sell me cakes.
It's a good business, right?
It's a good business, but then
it's like I think one of our clinics or there is a clinic somewhere that I've seen is right next to a club. So, and then after a long weekend or something, then the Monday is so busy. But so yes, I do bake.
You bake yourself?
Yes.
Yourself?
Myself. Fortunately, I do have staff who are able to help me out.
But you can do it.
Yes, but I can do it. I do it. Weekends, when I'm off from work. Wow. If I have the morning off and I'm going for the afternoon shift, I do check up on things. I do bake a few things. And then my parents are around, so they oversee a lot of things when I'm not there.
So you have like a bakery?
I did in Mombasa. And then when I moved here, I started off home-based. And now setting up a manufacturing point along Mombasa Road.
Manufacturing, big word.
So where I've got all my equipment and everything, but not really a sit-down style bakery where you can come in and have a coffee and a pie.
Oh, so
we would deliver.
Okay.
You can collect. And yeah.
And I have to ask this. Most very many people. Yeah, you've told me you've done the medicine. We call it medicine.
Yes,
the home care. You're in baking.
Yes.
And your businesses seem to be going well. What's the secret? Is it being Indian?
I don't know.
What is it with Indians? Because and I was saying it on my intro. Even you look at our businesses in Kenya, even hospitals, major hospitals, most of them, the big hospitals, the serious hospitals, not all of them, but most of them, Indian there,
Right.
What is it with Indians and business and teachers?
I don't know if there is a direct correlation, because even Kikuyus are very good in business.
Different kinds of business.
Because I've had friends who've actually told me, "Are you really Indian or you're Kikuyu?" Because sometimes I have moments where I wake up and I'm like, I need to try this, I need to do this, So, but for me, I think Medisam Consultancy was always an opportunity where I can capitalize my knowledge, my experience, diversify it because of my background in medicine, background in quality improvement.
Could do a lot of things.
When you're doing infection control, for example, you really know, and you're the one who tells housekeepers how the facility should be cleaned and maintained. So why not go out there and set up a cleaning facility? And I used to clean facility. I had set up a facility that used to offer cleaners. Now if I've got end-of-life patients in Mombasa, they're on palliative care. They may be at home with their loved ones, but I've got my caregivers there. I'm also the one who sends the housekeeper to sort of, because it's a clinical environment.
And the patient pays differently.
Diversification.
Back to you, everything.
So that was one thing. But yes, I think for me the long-term vision is what do I want when you can no longer practice medicine? What else can you do? And even if it's a hobby, can that hobby bring you some form of income?
Amazing.
That to me is very important. Otherwise, it's a waste of time if it's a hobby that you're not.
It's just a hobby for the
if it's a sport, it's a different thing. But even a sport, you can make it a professional sport.
Yeah, true.
Yes.
And nowadays, people even create content that they monetize from the sport they're doing.
Yes. I'm. When I look at what you do, I'm so envious sometimes. I can't think of flipping my camera and talking to people I don't know who's out there watching and listening. It can be overwhelming.
Especially in this era of people always lashing out. Some people will, but not always. Not everyone will like what you say, so you need some thick skin.
Yes. But for me, when it came to, I didn't start baking out of the passion for it, or that wasn't the vision. When I was in 5th year of medical school, I was diagnosed with Gilbert syndrome.
You have Gilbert's?
I have Gilbert's. So you stress me out and I'll get jaundiced.
Really?
Yeah.
Actually, I've actually noticed.
You've noticed.
I've noticed your eyes are a bit yellow. Just didn't want to ask.
Yes. So it was really, really bad in 5th year. I think that was the toughest year in medical school for me. Internship made it even harder, to the point where I was done with internship. I said, do I really want to do medicine? So in the middle of all of that, I had to come up with coping mechanisms, some way to let out a lot of the stress that built up in medical school. So I started cooking, actually.
Baking. Cooking is a way now you
so
let it go.
Yes. So in med school, I was cooking, and I enjoyed it. And I couldn't, of course, you couldn't go out and eat every single day. So you'd spend most of your time cooking. And then I would figure out, how can I make the meals more exciting and things like that. But I also found myself asking myself, can I make it easier for other students, for example, who are in campus, at least internationally, who want to cook, who want it really, really easy. what can I do? So I
You
actually
cooked
went.
for them?
No, I never cooked for them, but when I would cook on campus, it would usually be for special occasions. If it's Eid or something like that, I'd invite the other dorm students over and we'd eat together. But I started posting a lot of recipes online and photos and step by step, and I was very excited to see how other students were picking it up. So even if you go to our Facebook page, and I need to delete some of those things, but if you go all the way to the old photos, you'll find cooked food, like savory food.
Ah.
And the page name, so it's facebook.com/ABC meals. So it was always,
meals.
how can I make it as easy as ABC for other students as well?
Okay. So you like cooking?
I do. I like cooking.
Interesting.
Yes.
Interesting.
So fortunately, the woman who marries me.
Good for them.
Good for them, right?
Good for them.
Yeah.
Some of us, eh?
So when I came back during internship, post-internship, I started cooking, and then I started selling the food.
You monetized
I monetized it. And I thought to myself, look, if I'm making a meal today and I advertise that I'm making this meal and I get 5 orders for that meal, and I've already fed myself and I've made money from 4 other customers, for example.
Why not? So you opened.
I opened that aspect of it, but then I didn't really stick, because then the more commercial cooking becomes, the more hectic it became for me. So it added to more stress for me.
Now the jaundice.
Now the jaundice is back. So then I went to baking, and my parents have been in baking for years.
Okay, it's a family business.
As a family, so they used to bake in the 70s, late 70s and 80s. And then, but when I was born and as I was growing up, they went into, so they were working now.
Okay.
Yeah, so they were working. And when I came back, I pulled out a lot of my mom's recipes and
using them.
Yeah. So, my dad and his siblings were all into the baking industry.
Amazing. I will not forget, you promised us a cake when we'll be doing Daktari. Top Daktari Awards.
Yes. Cake on me.
Cake is on Daktari. And by the way, speaking of Top Daktari Awards, don't forget to nominate even Daktari here.
Yes.
Or if you're a medic, a nurse, whatever, nominate yourself.
Yes.
Nominate someone you know. Daktari, have you nominated someone?
I've nominated you.
Me? Okay. Don't nominate me.
I've nominated myself.
That's good.
Yeah.
But, okay. Amazing. Yeah. So head on. Website is right there. Right. Go nominate someone.
Yes.
Daktari, will you come? And I hope you win an award.
I hope so. But at the end of the day, it's all having fun and appreciating one another.
True.
Where is it planned for?
We're still planning.
All right.
We're still planning. We will invite people when everything is ready.
All right. Okay. Yeah. I think you need to have some cake on your set one of these days.
I thought you'd come with one.
And now we chose a Sunday, so Sundays is closed. But
okay.
Yes, but let me know the next time you're having a set. I will send one over.
Amazing. Yes. Amazing. Yeah. And people can order cakes.
Yes, I will send you the details. So it will be somewhere here on the screen.
We'll put it.
Hopefully.
Sawa. Yeah. Parting shot, Daktari. My producer is saying minutes.
Oh, it's time up. All right. I think parting shot is for anyone out there who is a medic, don't be afraid to explore beyond medicine. I think it's always important to go through life with the knowledge that, number one, diversify. Because it's okay to change your career 2, 3, 4 times in your life.
There's no limit.
You've got to be resilient and you've got to learn from experiences and you've got to make yourself better.
Yeah.
And I think that's very, very important.
We have a term for it right here on Daktari Akwikwan. We call it beyond the stethoscope.
Beyond the stethoscope, yes.
Amazing. Dr. Samji.
Asante.
Irfan.
Irfan, yes.
I was close. Thank you very much for gracing Daktari Akwikwan.
Sure. Thank you for having me.
We hope you come soon again and again.
Let's have a couple of more people, and I think the conversations are always more exciting. Yeah.
Sure. Yeah. Daktari Akwikwan, Dr. Irfan Samji, adios.